Influenza impacts everyone, right? You can be a super healthy person, do all the right things around eating and exercise, but you can still get influenza. It has to do with, who you're exposed to and your immune response. Hopefully you're vaccinated. And then do you have any medical issues, heart disease, lung disease? And unfortunately, things like pregnancy can put you at higher risk for disease progression once you're infected. And then lastly, age groups, usually much older adults and our youngest group. So what we're seeing right now is a lot of influenza in that 0 to 4-year-old age range, which is really a problem. Biggest risk groups we have here are the very young and the very old, right? So both those groups should be thinking about contacting their primary care doctor, or if their symptoms are severe enough to be seen right away, right? Urgent care, emergency department. Pregnant people should definitely be contacting their obstetrician or the primary care doctor about getting tested and treated as well. And then I'd say the other big group are people with other medical problems, heart disease, lung disease, you have kidney disease, or diabetes that's fairly progressed. All those folks should be contacting their primary care doctor by getting tested and treated. And the great benefit of a vaccine is that immune response kicks in at around 2 weeks. So it is still an absolutely great time to get influenza vaccination. So if you haven't gotten it so far this year, now's the time. Get it done now so that you can be ready for that peak coming out there, because there's going to be a lot of flu circulating everywhere we go. And it's important to recognize that the people who really transmit influenza are healthy adults, right? We're the biggest part of the population. We have an obligation not only to protect ourselves, but everyone around us. And vaccination is the most powerful thing we can do. What I would say, if you're looking for guidance, look to Washington State, look to UW Medicine, look to your trusted folks in your community. And I say really importantly, Washington State Department of Health and the Western States Coalition. What I would say the take home from all of those folks is that influenza vaccination is indicated and supported strongly in everyone 6 months and older. So even now, if you have a 6-month-old, a 7-month-old who hasn't yet been vaccinated, now's the time to do it. If you're an adult who hasn't been vaccinated, now is absolutely the time to do it. And certainly if you're a person at higher risk, being much older or have other medical problems, you still have time to get vaccinated right now.